Hello, and thank you for partnering with Asesso Health. Today, I will be walking you through how to fit a G1 Asesso Grind Guard. When reviewing your fitting guide, you'll notice the G1 is designed to sit on both bicuspids. Let's go step by step to ensure a proper fit for your patients. So first step is going to be, we're going to be checking the patient's mouth to see what size we're going to do. So we see here, go ahead and open. She's got both bicuspids, 1, 2, 1, 2 on the right and left side. So she will be a G1.
Next, we're going to want to make sure we have boiling water, and the boiling water is very important. So we're going to want to make sure we see the bubbles come up like that so we know it's ready.
Okay, so now our water is boiling. Just about halfway into the cup, we're going to take our G1 here. We'll notice the dots. This is where the first bicuspid is going to go, the second bicuspid, and then this part just sits on that first molar. We're going to drop the guard with the plates facing down. It sits in there for about 15 to 20 seconds before these two ends start to come together. Right before it comes together is when we will take it out. Right about there. Going to warn the patient it's going to be a little warm, and I'm going to put some pressure underneath the chin here. We want this front part of the guard to be right behind her canine. So I'm going to go in and open real big. Canine is right here. I'm going to go from a lingual to buccal. Hold this band in front, stretch it around, and a lingual to buccal. We're going to push down here. We're going to go in the inside, push in the back corner here, like so. Take the band and push it here, and bite down. And let them relax. After they've bitten down for about 15 seconds, you can go ahead and take the guard off. You're going to see it's just a nice little pop like that on both sides, mean you have a great fit. Now that you've seen how to fit a G1 Asesso Grind Guard, I will show you how to fit a G2 Asesso Grind Guard. When you refer back to the fitting guide, you will notice the G2 is designed to sit on the canine and bicuspid. Let's go step by step to ensure a proper fit for your patient. So what we're going to do first is assess the patient's mouth to see what size they're going to be. For our patient here, it looks like she's missing one of her bicuspids, so she's going to be a size G2. We're going to be fitting on her canine and the first bicuspid that she has, as you see here. To warn the patient, it's going to be a little warm, and we're going to put some pressure underneath the chin here. I'm going to make sure that this wall here is directly behind that tooth in front of the canine. Lingual to buccal. We're going to hold this band here while we come around and do a lingual to buccal. We're going to push on this front band here. Use that chin to push down, and then we're going to tuck in the inside corner here. And bite down. And then they could just relax.